Welcome back to Heal with Meals. Today, we're diving into an important topic, cholera. This dangerous disease can cause severe dehydration and even death if not treated promptly. Let's understand its causes, prevention, and the necessary precautions to stay safe. Cholera is an acute diarrheal illness caused by infection of the intestine with the bacterium Vibrio cholerae. The deadly effects of the disease are the result of a toxin the bacteria produce in the small intestine. This toxin causes the body to secrete enormous amounts of water, leading to diarrhea and a rapid loss of fluids and salts, known as electrolytes. Cholera-related diarrhea comes on suddenly and can quickly cause dangerous fluid loss, as much as a quart, or about 1 liter, an hour. This type of diarrhea often has a pale, milky appearance, resembling water in which rice has been rinsed. Vomiting is also common in the early stages and can last for hours, compounding the risk of dehydration. Dehydration can develop rapidly, sometimes within hours after symptoms start, and it can range from mild to severe. A loss of 10% or more of body weight indicates severe dehydration. Signs of cholera-induced dehydration include irritability, fatigue, sunken eyes, a dry mouth, extreme thirst, and dry, shriveled skin that's slow to bounce back when pinched. Dehydration can also lead to a rapid loss of minerals in your blood, known as an electrolyte imbalance. This can cause muscle cramps due to the loss of salts like sodium, chloride, and potassium. One of the most serious complications is hypovolemic shock, which occurs when low blood volume causes a drop in blood pressure and oxygen levels. If untreated, this can be fatal within minutes. Now, let's talk about the causes of cholera. A bacterium called Vibrio cholerae causes cholera infection. The toxin it produces in the small intestine leads to severe fluid loss. Cholera bacteria might not cause illness in all people who are exposed to them, but they can still pass the bacteria in their stool, contaminating food and water supplies. Contaminated water supplies are the main source of cholera infection. The bacterium can be found in 1. Surface or well water. Contaminated public wells are frequent sources of large-scale outbreaks. 2. Seafood. Eating raw or undercooked seafood, especially shellfish, from certain areas. 3. Raw fruits and vegetables. In regions with cholera, raw, unpeeled produce can be contaminated. 4. Grains. In areas where cholera is widespread, grains like rice and millet that are kept at room temperature after cooking can grow cholera bacteria. Everyone is susceptible to cholera, but certain factors can increase your risk. Let's look at these risk factors. Risk factors include 1. Poor sanitary conditions. Cholera thrives where sanitation is poor, such as in refugee camps and impoverished areas. 2. Reduced or non-existent stomach acid. People with low stomach acid levels lack the natural defense against cholera. 3. Household exposure. Living with someone who has cholera increases your risk. 4. Type O blood. People with type O blood are more susceptible to cholera for reasons not entirely understood. 5. Raw or undercooked shellfish. Consuming shellfish from contaminated waters increases your risk. Cholera can quickly become fatal if not treated. The rapid loss of fluids and electrolytes can lead to death within hours. Other complications include low blood sugar, low potassium levels, and kidney failure. Prevention is crucial. Here are some key precautions. 1. Wash your hands. Use soap and water frequently, especially after using the toilet and before handling food. 2. Drink safe water. Use bottled water or boil/disinfect your water. Avoid ice made from untreated water. 3. Eat safe food. Consume food that is thoroughly cooked and avoid street vendor food unless it's cooked in your presence. 4. Avoid raw seafood. Stay away from sushi and improperly cooked fish. 5. Peel your fruits and vegetables. Stick to fruits and veggies you can peel yourself. If you suspect cholera, seek medical help immediately. Rehydration is the primary treatment, using oral rehydration salts, ORS, or intravenous fluids in severe cases. Antibiotics may also be prescribed in severe cases to shorten the duration of the illness. Remember, cholera is preventable and treatable. By taking these precautions and acting quickly at the first sign of symptoms, we can reduce the risk and impact of this disease. Stay informed, stay safe, and keep healthy.